From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Good evening, this is Dr. Paul. Thank you very much for tuning to our channel this evening. This evening I want to talk a few minutes about bladder cancer. A very important topic. You see, prostate cancer, we hear about breast cancer, lung cancer, colon cancer, and bladder cancer is also a very common cancer affecting millions of people every year around the world. Let us see the most important points. More than 95% of the urothelial tumors in the United States are transitional cell in origin. That's an important point. More than 95% of urothelial tumors in the United States are transitional cell in origin. And now there are other types like squamous cancers with keratinization, and that can also happen in the bladder. And there can be adenocarcinomas or small cell tumors with paraneoplastic syndromes. They can all happen in the bladder, but the most common is transitional cell carcinoma. Please remember that. You see, the transitional epithelium, it covers the urinary tract from the pelvis, like renal pelvis, all the way up to the proximal 2/3 of the urethra. So it covers the pelvis, the renal pelvis, and it covers the ureters, then the bladder, and then the urethra. So that's why it's a very common type, because it covers a lot of area in the pelvic tract, urinary tract. So the bladder cancer is the fourth most common cancer in men. That's the very important part. The fourth most common cancer, but in women it has a lower place, like 13th. And the other important point is the incidence to mortality rate is 5:1. So if you get 5 cases, only 1% is dying. That's a good news, because that tells us that the most lethal types of bladder cancer are rare, and we can find them in superficially and we can treat them. And you see, folks, it is more common in men than in women, and it is twofold more common in whites than in blacks, and the median age at diagnosis is 65 years. So that is the median age, 65 years. The other important word you need to remember is poly-chronotropism, that the tendency to recur over the time and to happen in new locations in the urothelial tract. So that is poly-chronotropism. Please remember that term. That is the tendency to recur over time and to happen in new locations. And it has a lot of diagnostic value and also a very important point in the preventive care. Now, if you see these lesions, you need to continuously monitor it. You need to monitor the patient. Now, epidemiology. Let me give you the most important epidemiology, the cigarette smoking. The cigarette smoking is very strongly linked to bladder cancer. That's why it's important to encourage people to stop smoking. So even after 10 years, once they stop, still the risk is the same. So it's better to stop smoking as early as possible to prevent bladder cancer. There are other things like some drugs like aniline dyes, the aniline dyes, and the drugs like phenacetin or chlorpheniramine, and there is also external beam radiation. The other most important point is chronic cyclophosphamide exposure increases the risk of bladder cancer. Very important point. Chronic cyclophosphamide exposure increases the risk of bladder cancer. So you see these important etiological factors. in developing countries, Schistosoma hematobium. This parasite is clearly associated with the increased risk of bladder cancer. So that's another important point, folks. In developing countries, Schistosoma hematobium is a major risk factor for this problem. So there are three categories in terms of the types. The types are superficial, invasive, metastatic. Three types. Superficial, 75% are superficial. Then invasive, 20%. Then metastatic, 5%. That is the distribution. So those are the three types of the cancer. And as usual, the TNM classification is whether it is the tumor, how fast it is growing, and how many nodes it's involving, and how much is the extent of the metastasis. The TNM always comes as usual. But remember that the types, that's very important, based on the histopathology. Transitional epithelium, the squamous cell with keratinization, adenocarcinomas, and small cell cancers with paraneoplastic syndrome. So those are the four types in terms of histopathology. Now, what about adenocarcinomas? Adenocarcinomas, basically, they happen in the dome of the bladder or in the periurethral tissues, but they are not as common as the transitional cell carcinomas. So transitional carcinoma is like the prototype of this bladder cancer. Now there is a solitary and papillary in terms of the growth, and these, some of them, they become very friable. That means they have increased risk of bleeding, and they can also recur over the years, and when they progress and when they cause the metastasis to different parts of the body, the clinical presentation, it varies. Now let us see the most important clinical features. Hematuria, that's the most important thing you need to remember. Hematuria occurs in 80 to 90% of patients and often reflects exophytic tumors. You see, the bladder is the most common source of gross hematuria. But even in hematuria, the benign cystitis is more common than bladder cancer. So when you see hematuria, don't get panic, because benign causes are more common causes of hematuria than these lesions like bladder cancer. So the bladder is the most common source of hematuria, and benign cystitis is more common cause of the bladder. The benign cystitis is more common than the bladder cancer as a source of hematuria. The other important thing you need to remember here is that when you see the microscopic hematuria, there is more a sign of prostate cancer than bladder cancer. So when you see hematuria, you need to do urine cytology, you need to do intravenous pyrogram, cystoscopy, and you need to, based on the urine cytology, your next diagnostic tests are important. I mean, if you, for example, if you see the urine cytology, and that determines what other steps you are going to take. So if you see hematuria, always you need to suspect bladder cancer. There are other symptoms, like for example, if the urethra is blocked by the cancer, the patient can have the flank pain, and sometimes the metastasis from the bladder cancer can go into surrounding tissues. For example, if the metastasis goes into the colon, it can present with the constipation. If it goes into the rectum, constipation. So bladder cancer can present with many different symptoms, but the most common symptoms are hematuria and urinary obstruction. Those are the most common things. So when you see hematuria and urinary obstruction, I mean, you can think of prostate cancer, but most commonly, when there is these voiding symptoms, and also when there is the upper abdominal pain, lower abdominal pain, just above the pelvis, you need to think of bladder cancer, and you should go for a cystoscopy. And in cystoscopy, you see for the size and the number of lesions, the location of lesions, whether it is solid or papillary. And many times you can take a video of the whole procedure, and all visible tumors, they should be resected. That's very important. All visible tumors, they should be resected. And even though the tumor is here and below the muzzle, you need to take a part of the muzzle, because that helps you to assess the depth of the invasion. So you need to assess how deep the tumor has gone. That's why you need to resect the tumor and also a bit of the muzzle. And that helps you to stage the cancer. Is it a superficial cancer, or is it an invasive cancer or metastatic cancer? And also you do the selective catheterization and visualization of the upper tract. If the cytology is positive. So you take the cytology, and if the cytology is positive, you do selective catheterization and visualization of the upper tract. There are other tests like ultrasonography, CT scan, MRI. All those tests are useful to determine whether the tumor is extensive. You see the bladder cancer can go all over, and you need to determine how the extent of the spread. Is the distant metastasis? You need to do the CT scan. CT scan of the chest and the abdomen and the MRI. And also radionuclide imaging of the skeleton if you think of any bony metastasis. So diagnostic tests, they start from urine cytology and all the way to radionuclide imaging. Now there are two oncofatal antigens. Number one, HCG. Number two, carcinoembryonic antigen. These are expressed in 20% of transitional cell carcinomas. So two oncofatal antigens, HCG and carcinoembryonic antigen, are expressed by 20% of transitional cell carcinomas. And you don't use these markers routinely, but whenever there is a diagnostic dilemma, is this bladder cancer or prostate cancer? If you have that kind of diagnostic dilemma, you can always check for HCG and carcinoembryonic antigen. So those are the most important points, folks. We have seen what are the main types of bladder cancer, and based on histopathology, what are the main types of bladder cancer: superficial, invasive, metastatic, based on the extent of the disease. We have seen the percentage of each. We have seen that 90% is transitional cell cancer. We have seen the etiology, the cigarette smoking, aniline dyes, medications, and cyclophosphamide, cystosoma hematobium. And we have seen the clinical features, the most important being hematuria. And we have seen the diagnostic tests starting from urine cytology, and based on that going further like intravenous pyelogram and cystoscopy, and then based on the extent of the disease to find out the extent of the metastasis, to do the other tests like CT scan, MRI, ultrasound. So that is about the signs and symptoms and the diagnosis and etiology of bladder cancer. Tomorrow I will talk about the treatment of bladder cancer. Please make sure to watch that video also. Thank you very much.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.